A catheter is used to remove urine from the bladder in situations when there is a mechanical obstruction in the urethra or retention of urine due to a nerve block. It can also be used in cases when urine needs to be carefully measured. A catheter may also be used when a patient must be immobilized during many surgical procedures.
Sterile gloves, swab sticks, sterile water or saline, gel, tube to collect for urine sample or specimen, label, Foley catheter. During the nurse's assessment, the nurse finds the patient is attending surgery due to a mechanical obstruction in the bladder. The intervention is to place a catheter to measure urine output postoperatively. The expected outcome will be that the patient can completely void after 3 days without the use of a catheter. As with any time you are entering a patient's room, introduce yourself to the patient, perform hand hygiene, use 2 identifiers to identify your patient, provide privacy, and explain the procedure.
Hello! Hello! My name is Carly. I'm going to be your student nurse today.
And my name is Jennifer, and I'm also the student nurse for today.
Could you tell me your name and birth date? Okay, I'm going to check your armband to check. Okay, perfect. Today we'll be inserting a Foley catheter. Do you know what that is? Okay, so the doctor has ordered it.
I'm going to raise you up.
You raise me up
I'm going to put your head back.
I can stand on mountains.
And I'm going to go ahead and move your legs into a frog position.
When applying sterile gloves, remember to only touch the lower cuff as to not contaminate the rest of the glove.
Cleanse by wiping the far labial fold, the near labial fold, and directly over the center of the urethral meatus. Appropriately dispose the used cotton balls or swabs without contaminating the sterile field.
How are you feeling? Are you experiencing any discomfort? Oh, good. Do you have any questions for us? Okay, if you have any questions or concerns, or if you need something, here's your call bell. And we will come back to check on you later.
During the nurse's assessment, the nurse asks the patient about urinary patterns. The patient states he is experiencing pain when voiding and residual urine. The nurse diagnoses the patient as risk for urinary retention as evidenced by residual urine. The intervention is to place an intermittent catheter to measure residual urine. The expected outcome is that the patient will be able to void completely in 3 days.
Hi, my name is Jadon Tate. I'll be your student nurse today.
I'm Anna. I'm going to be assisting him.
May I go ahead and get your name and date of birth? All right, thank you very much. The doctor today has ordered a catheter to be put in for urinary retention. When inserting a Foley catheter into a male, you prepare the sterile field the same way you do as the female. The center ones, discard that. Loop around the outside. Go down a little bit further and work your way down, never coming back towards the center. You insert it till you see a flash. That means you're in the bladder. Then you go in about 2 more inches and you fill up the catheter's bladder.